say you can write any comment, write any questions during the presentation. We have a window in the program, it's called a Q&A. Write anytime you feel you want to ask something. In the end of this presentation, I'm going to answer all your questions. So today we talk about acne. Why we do care about acne? Well, because acne actually, it's affect more than 85 teenagers, most of all. But not only, actually affect also 20%, more than 20% of adults, especially women. Even when from over 25, 40 years old. It's a genetic rule. I mean, it's most of the time we have acne for a genetic, because maybe our parents, somebody in the family have, but we have other reasons why we can get the acne. Acne it's very, very common. In fact, we say everybody, we experience at least once in our life about acne. When I'm talking about acne, it doesn't mean the most severe acne, but we have also mild acne, which is can affect us during our life. What is association with acne is disfigurement, pain, loss of confidence, depression, but it's a kind of really sickness for the skin. It's basically, it's well known as acne, is known as acne vulgaris, and is a chronic inflammatory condition which appear with pimples, with the spot, and there can be different levels of acne. It can be superficial acne or more deep acne. It can affect the face, shoulder, back, neck, chest, even sometimes the scalp, and definitely affect our life. So acne, it's happened for one specific reason. The pore is become blocked, is clogged the pore. Pore is the way easy to say air follicles. In the air follicles, we have the specific gland, so which is produced sebum. And this sebum is it's produced from this specific sebaceous gland. And this sebum normally has to be produced because it has to be moisturize the air inside the follicles and travel all around on top of the surface of the skin to moisturize in the skin. But sometimes the gland, the sebaceous gland, produces too much sebum, and combine with the dead skin cell, they block, they close the pore. And this becomes the problem because the sebum, too much oily production, is inside the pore, and the consequences created the perfect environment for bacteria to create infection and also later the inflammation. Bacteria are on the skin, but of course, you know, when the pore is blocked, too much sebum production, this is the perfect environment for the bacteria. So you can see in the pathophysiology, the acne, you can see in the picture on the left side, we have healthy hair follicles. And what happened on the right side? Basically, the acne is based in 4 different factors. The first one, as I mentioned before, you can see here the pore or the hair follicle become blocked and plugging from too much sebum production. You can see here, I move the mouse. This is the sebaceous gland. They produce too much sebum, and instead to go on the surface, it stays inside the hair follicle. So we have another reason, hyperactive sebaceous gland. This situation is creating the bacteria, start to grow in the bacteria inside, and you can see deep down and on the surface of the skin with a different skin blemish, we have inflammatory. So inflammation is the consequence and the problem. I explained there is different type of acne, and acne can be more superficial acne, and this is more non-inflammatory acne. It's very characterized from comedones, especially what we define black head and white head. Or inflammatory. Inflammatory more deep down is characterized from papules, pustule, nodules, and cystis for inflammatory acne. So here on the pictures, you can see acne appear with a different blemish. If you see whitehead, blackhead, that's we define non-inflammatory acne. It's very common. This is something we experience, almost everybody. And this is more superficial and it's more for mild acne. We have a papule and pustule. Papule and pustule, you can see the skin has appear red. We have a pus. This actually is caused from bacteria. And also we have inflammatory. And this we define, we have for sure in the moderate and the severe acne. And the severe acne is more deep down, and we have the nodules and the cysts. So which is the one, they are more painful, and the consequence also are scars. So non-inflammatory acne, whitehead and blackhead. Usually we don't have a swelling, usually they are not very painful, sometimes not at all, but it's very important to counteract, otherwise they can block and also the pore and causing more severe acne with the scar or hyperpigmentation, post-inflammatory acne as a consequence. Inflammatory acne, it's defined with the papules, pustule, nodules, or more severe, the cyst one. This is very painful, definitely is inflammatory on the surface. For the cause about acne, we have a different situation can cause acne. For example, we have genetic. Genetic, as I mentioned before, if you have somebody in the family, we have more possibility to get the acne as well. And this more connected with the overactive sebaceous gland, too much production of sebum. But sometimes it is caused from cosmetics, product we use for skincare or for makeup products, and that's especially when they are not comedogenic and have the tendency to clog your pore. Other situation can be medication, sometimes such as, for example, corticosteroid, certain kind of contraceptive pills, progestin can cause most of the time, usually they cure the acne, but some of the pills, they can also cause acne as well. So drugs can be another reason. Hormones imbalance, that's why it's more common when we are teenager, but especially women during our lifetime, for example, during the period, they face the acne, get worse, sometimes some breakdown during the pregnancy. So we have hormones imbalance, and this is the situation where acne appear or get worse. But also diet and lifestyle is not the real consequence, but it can get worse when we have acne. For example, stress, pollutions. If we sweat a lot, don't clean the area where we sweat, unfortunately change the pH, and also we can have the proliferation of bacteria and the consequence acne. 30 kind of food and not too much sleep. Of course, diet and lifestyle is always something we need to have more in balance for all entire body, for all the organs, and of course, as the organs, also the skin as well. So we say that we have non-inflammatory and inflammatory, which is more severe acne. We have a more superficial acne, which is we define as a mild acne with the comedones. Both are comedones, but it can be closed comedones. It's called whitehead, or open comedones. It's called blackhead. Moderate acne, we have inflammatory, it starts to have a little bit painful in some areas, and it's categorized always the comedones plus papules and pustules. And severe acne, we have definitely more inflammatory, more number of pustule, papules, and started to have nodules and cyst lesion more deep down into the dermis. Acne, it's grade, so we can find, we define acne as a mild, moderate, and severe. You can see in the pictures, it's very obviously to see the difference. Here in the mild, you don't have inflammatory. In the moderate and the severe, you can have more inflammatory, but also doctor define, depend on the lesion you have, and the number also of the lesion you have. So that's defined more moderate or more severe one. But for sure, moderate and severe one are the one you need to, first of all, you know, to care more, to work as anti-inflammatory, to counteract the propionic bacterium acne, which is, it's called P. acne bacteria, and to prevent the scar or the hyperpigmentation you can have once the acne it's healing by itself. Now let's go a little bit more closer about the blemish, what it look like. So here we deal with the mild acne. We can see on the left side the blackhead, and on the right side the whitehead. Both of them, they are very similar. So the pore, it's clogged, it's blocked with the too much sebum, too much dead cell. But the difference, the black one inside of the surface is open, the skin is open, and that's why it's become black because the sebum get out, and on the air is oxidated, and you can see this roundish spot black. The white is exactly the same reason why happened the blackhead, but on the surface is closed. So it doesn't become black because it doesn't oxidize. And you can see basically the sebum appear with this white color. Here we have this papule and pustule in the moderate, but of course also in the severe one. You can start to see here red, there is inflammatory, and when there is inflammatory, we started to have a problem with basically with inflammation and also bacteria. The papules here, or well known as the pimples, is the one some people they have the tendencies to squeeze, which is we should never squeeze, because the infection, they can spread even more on the skin, and it's breaking underneath, and then you can have for sure spot and maybe also scars as the consequences. The papules is look like the same than the pimples, but you have you can see here very small yellow white spot, which is the pus, is the infection. But both of them, they are inflammatory. And here we can go more definitely in the severe one, which is appear nodules and the cyst. Nodule and cyst are become quite bigger, very painful. The difference is nodules usually when you touch, apart the painful, you can see a little bit hard. And the cysts usually are quite fluid, they're quite mobile, okay? But both of them, they are digging deep down into the dermis. And those one, unfortunately, the one we need to prevent, but we can treat, of course, with the jet peel, and we needed to treat because are the one especially cause, unfortunately, scars, keloid, and also spot as a hyperpigmentation. So now you understand different type of lesion, different type of blemish, and of acne. Sometimes you have all together, sometimes you have some of them. Depend if it's superficial or moderate or more severe acne. So the consequence of the acne, which is we need to do prevention. And of course, we can treat even the most severe acne with the jet peel. I'm going to explain later with the product and how we are going to perform in this type of treatment. It's very important because acne created the complication of scar, and the scar are for all your life after, okay? Scar is a consequence of the skin, especially the cyst, the most severe acne, which is when they try to heal themselves. Basically, they destroyed all the tissue, and we have less collagen, and this is the consequence of the scars. When we talk about scars, we have different type of scars, and you have scars because you have inflammatory, you have a red area. Scars can appear in the different shape and the different colors. They call ice pink scars, thumbprint scars, hypertrophic polar scars, the one more common one, keloid, but always are scars. Okay, consequences of inflammation. You can see here these quite common scars. They can be different levels of scars as well. And this, when we have acne vulgaris, in 95% of the people suffer from acne vulgaris, they are going to have scars. And once again, the scars are the consequence of the have less, collagen, because the tissue it's healing, is a healing response to care about the acne it had before. So hyperpigmentation, also this, you can see hyperpigmentation most of the time when you have scars. Around you have hyperpigmentation, and this is not the hyperpigmentation we can define like a sunspot, age spot. It's not like that. It's a specific hyperpigmentation post-inflammatory, and acne is inflammatory. Why happened that? Because is another way for, in the natural way, our skin try to heal in, to care about themselves when we have inflammation. So basically, it's given the signal in some way to the melanocytocyte. The melanocytocyte is the cell based on the base part of the epidermis. They are the one, they normally produce melanin when we are under the sun, on the UV ray. But in this situation, when we have inflammatory, there is some kind of signal inside the skin, which is this cell that start to produce the melanin as a response for this inflammatory. The consequence, we can have scars and hyperpigmentation. Especially more the skin, it's a dark skin as a tone, and more in the acne, in the inflammatory one, we can have a more spot. Now, we start to wonder maybe if there is any connection with the oily skin with the acne, which means, okay, maybe I have oily skin. If I have oily skin, if I don't treat oily skin, I will have acne. The answer is no, not specific. Of course, if you have oily skin, you need to balance the oily skin. because oily skin is more in the teeth zone, forehead, the nose, and the chin, and this is a little bit more oily part for everybody. But the acne, you can have even if you have a dry skin or normal skin. Why? Because the reason can be hormones, can be medication, pollutions, stress, all the causes I mentioned before, and suddenly maybe we can have the acne. So everyone could get the acne. So what is very important is a prevention. Prevention means in the acne situation, first exfoliating the skin, maintain exfoliating in the very gently way, in the perfect way on the surface, make the skin detox, oxygenate the skin, and rebalance the oil in production. If the semo produce too much oil, you need to rebalance with JetPeel and with specific jet solutions for that, just to prevent, as you can see here in the pictures, the bacteria, the inflammatory, and all the different blemish we can have. Now, the JetPeel, it's we know it does have a very important action on the different type of skin condition, but even the most difficult one, and acne, especially when we imagine the severe acne, which is we have a lot inflammatory, you have to imagine it's very painful. The patients is very scared to treat them skin because they're scared from the pain. So because of the JetPeel, we never touch the skin, and thanks to the active ingredients is exfoliating the skin without peel. And the acne needed to exfoliate, but in the very gently way. Thanks to the jet stream oxygenating the skin, it's sealing the skin, it's clean the pore, which is very important. It's also it's treated the bacteria, but in the same time, it also is prevent the secondary infection, because once you have one, you can have even more, you know, it can be like a chronic disease, you know, for the skin, a chronic condition. But also it's healing the skin, it's exfoliating. So we can really treat the acne in the different ways thanks to the JetPeel. And actually there are not many other procedure you can do it when you have very severe acne condition. We know the first step in the JetPeel treatment is lymphatic drainage. Lymphatic drainage is crucial. I all the time explain that. It's very, very important. And in the acne, it's even more. Usually we do three passages 3 times for every single movement in the lymphatic drainage. In the acne, especially when you have inflammatory and you have a bacteria, please maybe do some step more, maybe 5 movements for each, because the lymphatic system, you can see it's spread all over the entire body, and they collect all the fluid in all the tissue, okay? And pass through this small vein, kind of vein, you know, of the lymphatic capillaries, and they went to these knots. These are or filter. They are the lymph node. Lymph node, we have the white cell inside, and the filter. They kill all the bacteria, all the toxin, and this is very important because once is completely clean, the lymph is go back in the blood circulation again. So here we need to help even more with the lymphatic drainage to rid off all the toxin, all the bacteria, all the enemy they try to get more in trouble or swelling or breakdown on acne. Okay, so now, before to start with the what type of jet solution will be the best, what protocol will be the best, we are going to see Natalie now, which is she's ready to start the treatment. Here we can see Natalie. So Natalie, she starts to perform, the first step is a lymphatic drainage. You're going to see Natalie in the background, meanwhile I continue this presentation. So she used the triple noses with the jet detox water, which is I'm going to talk very soon, the power of these solutions. And she performing, can be 3 or even 5 movement on his model, which is suffer from acne. The second step, after she finished the lymphatic drainage, she's going to performing the exfoliation, and she's going to use exfoliation with the renewal complex 4, which is contain mandelic acid, malic acid, salicylic acid. And after, she's going to do the hydroporation, but meanwhile she carry on with the lymphatic drainage and the exfoliation. You can see her in the background. You can also, later when she's going to do the main action, the hydroporation, she will be in the big screen, so then you can see exactly how do the hydroporation on acne. Okay, so meanwhile we carry on the presentation. When she's going to the most main important part, not important part, but now is the preparation for the operation, then you can see her in the big screen. Now let's continue with will be the best solutions for treat the acne. This jet detox water is the one she's going to use, Natalie, right now, because we are going to use it for the lymphatic drainage. But we use also when we have inflammatory, very sensitive skin and acne, especially in the severe or moderate, but with a lot inflammatory. We needed to exfoliate in the very gently way. We can use jet detox water even for exfoliation. And remember also to remove the glycolic acid, okay? But we're going to see later. Why this jet detox water is crucial. It's help even more when we do the exfoliation, because actually it's contain silver oxide. It's a very powerful active ingredients, antibacterial, antivirus. It's deep detox the skin, detox the pore. Alloy, it's sealing the skin, and hyaluronic acids maintain very hydrating. Another important product I mentioned before, and this is the one she's using right now, Natalie, in the exfoliation she's holding now, is the Renewal Complex 4. Renewal Complex 4 we are going to use it during the second step, so the exfoliation. This product is a blend of mandelic acid, which is quite soft, to exfoliating, especially the very delicate skin. Salicylic acid, very powerful antibacterial, and help to clean the pore, okay, for prevention the block and of course bacteria as well, and malic acid. All of these 3 cocktail of specific acid are perfect for treat the acne and even for oily skin, because it's sebo rebalance. Another product is the Pure, or you know as the acne. Okay, is we change the package, we change the name, which is make more more good, even the name, because the name is say pure what acne. Exactly the same formula of the acne one, and this is the one Natalie she's going to use later on his model. Acne is contain anaxidol, is a biomimetic peptide, which is a formula from hydroxyl acid come from the royal jelly, which is they test in vitro. They have the power of diminish the probionic bacterium acne, okay, the P acne, minus 40%. So prevention in the very oily skin to sebum rebalance, but also kill the bacteria. We have other active ingredients, palmitoyl tripeptide 8, aloe, phytic acid combined together, the antiseptic, antibacteric, healing the skin and soothing in the same time. Another product we can use in the area where we have a lot inflammatory is the cuperose sensitive skin. This product it's not only for cuperose, it's only, as I say, sensitive skin in any situation when we have inflammatory. So you can use it in the hydroporation, you can use in the area, combine with the pure, okay, for soothing, to calming the irritation. This is why, especially in the very active acne, you use combine. It's cuperose sensitive skin solutions contain aloe, niacinamide, well known as a vitamin B3, azelaic acid, troxerutine, very powerful active ingredients in the soothing the skin, calm the skin, rebalance and healing the skin. Now, other product I mentioned, in the post-acne, so when we start to have scars or also hyperpigmentation, so the acne active, it's gone, there is not inflammatory. It's closed, but we have the scars and the hyperpigmentation. In this situation, for the exfoliation, we are going to choose between Renewal Complex 2, which is contain glycolic acid 10%, or Renewal Complex 3 with 16% of glycolic acid. In this situation, we are going to treat the post-acne during the exfoliation because glycolic acid is more regenerating the skin and correct more the blemish and create new baby skin, especially on the surface, and minimize the scars and the hyperpigmentation. When we have hyperpigmentation, the whitening complex 1, which is a rich or big amount of vitamin C, stable vitamin C in the high concentration, and the bio white combined together as natural ingredients like a lemon balm, achillea, grape wine, which is together with the vitamin C, the correct hyperpigmentation we can use in the area where we have the spot as a post-inflammatory. And the last one I want to talk, also for scars, we are going to use the whitening complex 1 because whitening complex 1 is rich of hyaluronic acid for different molecular weight and perfect to treat the scars, combined with anti-aging complex 2, which is a vegetal stem cell, and they're regenerating the skin for the scars. We are going to see this in the protocols. Now, as a protocols for the mild acne, which is not inflammatory, you can see more blackhead, whitehead, you can see here on the pictures on the right side. We definitely do lymphatic drainage with detox water. In this situation, we want to rebalance, do soft exfoliation, but also rebalance the oily skin. We are going to use Renewal Complex 4 with mandelic acid, salicylic acid. And we are going to use the pure for the hydroporation. Usually in the mild acne, 4 section, once a week is enough, maintenance always once a month. In the moderate acne, yeah, you can see we start to have inflammatory, take more time for lymphatic drainage, exfoliations to be in the soft way, So we can alternate the detox water, which is exfoliating the gently way, detox the skin, and the renewal complex 4, okay, with the mandelic salicylic acid. Hydroporation, in this situation, we have to combine the pure for the acne, and also in the area where we have sensitive skin, the product for cuperose and sensitive skin to soothing. Usually in the moderator, we do 5 sections once a week, maintenance once a month. And in the severe acne, extra step for most, I would say 1-2 movement more for lymphatic drainage. Definitely we deal with inflammatory, it's very painful, so detox water and renewal complex for malic salicylic acid for exfoliation alternate. And we are going to use both cuperose for the area where it is sensitive, and the pure for the acne one. If in this situation, the severe, we can have some area where the acne is more digging into the skin and we wanted to treat more the area, we can also use the Magican piece with the acne, or maybe with the cuperose if you needed to work as anti-inflammatory specific in the area. Remember, triple nose all over for the hand piece, and the Magic you always care as a booster, as an extra, with extra product to work more deep down. In the severe acne, we suggest a 6 section once a week, maintenance always once a month. Now we start to think about the post-acne, and we deal with the scars. In the scar situation, lymphatic drainage is always important because it's always healing the skin, and it's working very well also with the scars in the regeneration, the cell. And in this situation, you need to use the glycolic acid because we don't have inflammatory, we don't have active acne anymore, but we needed to regenerate deep down. So choose or 10% or 16%, or alternate according what how thicker is the skin, or how damaged is, how deep down is the scars. You do exfoliation with the glycolic acid. You leave on the surface glycolic acid once you finish the exfoliation between 3 to 5 minutes, and then you must wash with the detox water, okay? And after, in this situation, for scars, very important to use anti-aging complex 1 with containing hyaluronic acid inside. And in the very deep scar, we can also use the Magican piece for more deep down infusion, and you can alternate anti-aging complex 1 with anti-aging complex 2, direct on the scars. So this is a regeneration and feel the scars appear less visible, and anti-aging complex 2 with the vegetal stem cell regenerating the cell as well. And for the hyperpigmentation, always glycolic acid for exfoliation, and we are going to use the whitening on the area where we have hyperpigmentation. And in the very stubborn hyperpigmentation, you can use also the Magic, usually 6 sections once a week, maintenance once a month. Now, we can see, we put Natalie in the big screen, and we are going to see Natalie. She is going to do the hydroporation. Okay, we can stop to share. Let's see. Okay, Natalie, you can put in the big screen. Here she is. Okay, Natalie, now she's performing the hydroporation. See, she does move as a zigzag movement, very close to the skin, 90 degree. It's between 8 to 11 millimeters far away like this from the skin, and must be perpendicular, okay? And the movement, as you can see, are back and forth, the zigzag, but slowly, has to be slowly, because, you know, this creates a barophoresis on the skin, and never do fast, okay? Most people, they ask me, when they do hydroporation, if you should pass one time or more than one time. Well, if you go slowly, as you know, as you can see very well now, what Natalie she's doing here, when she uses the handpiece, it's created these kind of bubbles, you know, and in the way she does, slowly like this, you don't need to pass more than one time. Just one time is enough if you perform it properly. Or you can choose to use the magic handpiece and apply extra product. Can be always the pure products, is the same, but change the handpiece, always use a 90-degree, so perpendicular, very close to the skin. You can go more deep down. She is not going to use the magic because her model is suffer from acne, but not so severe acne, okay? And usually is enough to use the triple nozzles and piece. Remember, it's a pleasant, actually, the sensation of a cooling sensation by itself. It's a relief also, the pain. JetPeel, it's completely pain-free. And there is a very simple way to treat the acne. I had to say, you know, I'm going to show some pictures very soon and experience share with people around the world, clinics. They are very, very impressed for the result. Patients, they feel very comfortable. So very, very good result. And usually it's very difficult to exfoliate the skin when somebody suffers from acne, from inflammatory, because this what is making unique this technology, because we never touch the skin. We infusion solutions, and we give the benefit also. Once you finish, the skin is more glowing, but it's more soothing. It's less red. And this you can see immediately after the first section. Now, Natalie, she showed the face, you know, but remember, acne can be also on the neck, can be on the chest, can be some people on the scalp, more closer to the area of the neck or the arms. So you can perform it by choosing what type of blemish appear, mild, moderate, or severe, and use the same protocol and do the same in the area where appear the acne. Okay, these are the area. So meanwhile, I'm checking if there is some questions. Okay, there is some, how about stubborn acne that always appear at the cheek and like always, okay, for stubborn acne, okay, acne is sometimes because it's connected with the hormones, especially in the teenager, or because maybe you take some medication, sometimes have the tendency to appear, you know. It's depends what are the cause in the original, in what is the cause of the acne, but use the most stubborn one, continue. In case 6 section is not enough, you can continue with some extra treatment. Okay, if the person have acne and the cuperose both, which treatment usually, yes. Okay, once again, if you have acne and cuperose, here we are, you know, use both the products, because cuperose is more connected with the capillaris, with the skin very sensitive. And there is a specific cuperose sensitive skin, which is the perfect capillary protector, is soothing and correct the cuperose. But this product, as you see, is connected also with the acne, only when the acne appear with inflammatory. So you can use both. And you can also use in the localize by do hydroporation and choose by use the triple nozzle or the magic in the area you wanted to treat. You can use combine. Karen, hi Laura, I wanted to check that the acne function product is now named Pure. Yes, the acne is exactly the same. We call now Pure, but the formula is that one. It's just changed the name, okay? Exactly the same one. You have other questions meanwhile? Now it's very important. Once you finish the treatment, the small amount stay in the surface, just massage gently. If you have inflammatory, don't massage, don't rub, you know, much, but just like do how she does Natalie, you know, like just tip like in this way, touching the very soft way when we have inflammatory. Other questions? Thank you, Natalie. Maybe we can see closer the skin. Yeah, it's a show very glowing skin. Remember, when we have glowing skin, because the skin is healthy, okay? And is less, is a soothing. There is, you have immediately the benefit and there is not any discomfort. So the model is smiling. So I think I really enjoy. And of course, Natalie, she suggested to come back in 1 week time. Thank you, Natalie. Thank you very much. There is another question. Is the acne treatment also suitable for younger people? For example, 15, 18 years? Yes, in the teenager time, definitely is. We have imbalance hormones, and we have a more tendency to have acne in the teenager time. Of course, when you're very young, use the 3-step, very important, the lymphatic drainage, do exfoliation with the detox water is very soothing, very detox, and use the pure or combine with the sensitive skin for eventually for inflammatory. You need to start as soon as you can see the problem. Because especially we wanted to prevent the scars. Now, I want to share with you some before and after, but this is just a few, but we have plenty of pictures. Somebody asked if, yes, what is pure acne? Is it the same product of acne? Pure is like a purified, and acne needed to purify. We changed just the name, okay? Is the same product of acne. We can maybe send, in this slide, in this, in this presentation, you find the slide with all the main active ingredients. Let's see some before and after pictures. Okay, so this young lady I personally treat, she does have a mild acne, but maybe here it doesn't see very well in these specific pictures, but in some area that does have a little bit inflammatory. So this was before, and this after 4 section, treat once a week. With the JetPeel. There is one more closer pictures you can see here. On the left side, you can see the texture of the skin, the large pore. You can see here there is inflammatory when you have a red And how change after 4 section completely change the texture. It's more purified, less imperfection. There is another question. Is it allowed to do acne treatment if the acne is still on inflammation? Yes. We needed to treat as soon as possible with inflammation. How to do it? Remember, use in the pure inflammation, detox water for gently soothing, and thanks to the oxidite, is detox the skin. You can really, even when it's breakdown, it's kind of bleeding, swollen, it's perfect, it's healing, and not painful, okay? In case you can stay a little bit far away with the end piece, but you can do the exfoliation. You can always have the control on the skin and use the pure, because there is a bacteria. We needed to be sure the bacteria, we kill the bacteria, and use the Couperose and sensitive skin solution to soothe the skin. So here you can see before and after 4 section. Here you can see on the forehead how it's completely changed, more bright, because bright illuminating, because the skin is healthy. The other part is kind of suffocating, no? Is that they are block the pores, and you can see the texture is changing. You can see in this part close to the eyebrows, small small scars, you know, and also that how appear less. Now I have a more a post-acne. We can have here, you can see before and after 4 section, but here you can see even better in these pictures. This is a lady I treat. This definitely you can see. I also improve as anti-aging because on her I use the glycolic acid, sometimes 10%, 16%, and also I use the hyaluronic acid as well. And how change after 4 section. Okay. And here you can see also very active acne in certain specific area. This active acne is breakdown, and I'll get better after 6 section. Now I